Fred Hutchinson Cancer Center acknowledges the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. Welcome, good afternoon, everyone. I am Dr. Paul Buckley, Vice President and Chief Diversity and Inclusion Officer at Fred Hutchinson Cancer Center. Welcome to the second dialogue, Solidarity in Diaspora, Aspirations, Culture, and Building Community, part of the Public Art and Community Dialogue Program sponsored by the DEI Corps. Thank you for being here for this important dialogue. And thank you to our ASL interpreters, Seven and Heidi. And thank you to the production team, staff members of the DEI Corps. Why are we here? Fred Hutch is taking an authentic, affirming, and active approach to sharing the message that Black, Indigenous, and all people of color and other minoritized and underrepresented people matter to us. They matter in our science, and they matter in our community and beyond. We are engaging this program to deepen our institutional and community relationships and partnerships. And these conversations will ultimately shape how our selected artist in this program represents our commitment to and solidarity with the Asian, Asian American, Pacific Islander, and Native Hawaiian communities with their commissioned art. The program also provides an opportunity, several opportunities for the selected artists to connect, explore, or align with each other and representatives from the Fred Hutch to inform their final commissioned art and future community initiatives. These art installations that began several months ago with the Black community and the Indigenous community, and now the AANHPI communities, serve to engage other underrepresented communities as well to create a broader and connected messages of solidarity. Community solidarity and trust building are essential to our goal of equity and inclusive healthcare, specifically cancer research and care. So these dialogues are providing an opportunity for employees and the broader Seattle community to be in dialogue about community solidarity and our pursuit of equity in research and healthcare. Today, our dialogue will center around lived experiences, reflections, and aspirations for building community and sustained health. So we encourage all of you who have gathered with us today, and we thank you for making time post the recent holiday, whatever it has meant to you. Hopefully you enjoyed a wonderful time with loved ones and enjoyed food as fruit of your labors. And so thank you for being with us at the start of this week. You may send your questions through the chat to our panelists as we move through this dialogue process. At this time, I want to bring on Tiffany Go, who will be leading our dialogue and discussion today. Tiffany Go is the Health Equity Program Manager at Fred Hutch, focused on identifying and addressing healthcare disparities in patient care. She was previously co-chair of the Legacy SCCA's Diversity, Equity, and Inclusion Council. Her career in community volunteerism have centered on serving marginalized communities with a health equity lens. And Tiffany earned a Bachelor of Arts in Human Services and Rehabilitation at Western Washington University and a master's degree in public administration from Seattle University. Tiffany serves on the United Way King County Emerging Leaders 365 Committee. That committee is a mouthful, Tiffany. And she lives in Federal Way, Washington. Tiffany, thanks so much for joining us. It's always a pleasure to be with you, and thank you for agreeing to serve as our facilitator this afternoon. I'm also excited to bring on again our selected artists for this installment of the program, Sayare Rafai, who we introduced at our last dialogue. Sayare, they, them, she, her, is a Chinese Iranian artist based on the traditional lands of the Puyallup and Coast Salish peoples, referred to as Tacoma, Washington. And their favorite mediums as an artist, include community murals, printmaking, drawings, and poetry. They strive to utilize art as a means of community building, education, and healing. In 2020, they became a member of Just Seeds Artists Cooperative, a transnational decentralized network of artists committed to social, environmental, and political engagement. You can find out more about their work at www.justseeds.org and search for Sayare, Saiyare, Rafai, Refai. You can also find them on Instagram, and that information is in the chat. All right, so before I turn it completely over to you, Tiffany, again, thank you both for being here. I'm curious what your reflections are about what this program could mean for the Asian American, Native Hawaiian, and Pacific Islander communities, both here at Fred Hutch and in the broader community in Seattle, King County, and our entire catchment area. What do you see as the potential for this program?
Thanks, Paul. I'm so delighted to be here. Hi, everyone. I'm Tiffany. My pronouns are she, her, hers. And just top of mind for me, I think of just visibility and community building, where our ANHPI community members can be seen, can be heard, have strong representation. It's honoring and celebrating the breadth of diversity within our community, not just within Fred Hutch, not just within our community here, but our larger catchment area, which is the whole state of Washington as well. So just having that large celebration, communal sense of identity, connection, sense of belonging, community bond, just so important. And then the last thing for me that when I'm kind of thinking about this program and reflecting, is just bringing awareness, just kind of shedding light on just what's been happening over the last few years. So just incidents of anti-Asian hate, especially during the height of the COVID-19 pandemic. So this is a time for us to build a foundation of solidarity and unity, and combating that anti-Asian hate. And I feel like this program is really on the cusp of that. So yeah, those are my initial thoughts.
Thanks, Tiffany. Sayare, your reflections.
Thanks, Dr. Buckley. For me, I think similarly to what Tiffany is saying, just the opportunity for reflection, for community building, for representation. I think we often clump together as a group, but we have so many nuances and complexities, but also commonalities, I think, in how our communities have been impacted across history and currently, in the ways that our homelands are being targeted for natural resources, and the ways that impacts health, and the ways that people have forcibly migrated or chose to migrate to the mainland, to the United States, and with them, coming with this loss of land and community, and trying to find that here, and experiencing all of these different health disparities that may be rooted in the similar things. So I'm hoping we can get to some of that today in conversation, but also I see this as an opportunity for folks who are working at Fred Hutch to be in community with each other, and to see each other, meet each other, and for the wider community to know the work that you all are doing and to learn from this equity work.
Thank you both so much for your reflections. I am excited about the dialogue today, and I know it will be very thoughtful and impactful. And so I thank you both, and all those who are participating in the dialogue today. And for those who are tuning in to listen and engage, we strongly encourage you to really engage thoughtfully this dialogue this afternoon. Now, Tiffany, the screen is all yours. See you on the other side.
Thank you so much, Paul. And at this time, I would like to introduce my colleagues who will be joining Cyree and I in this discussion. Each member has their own perspectives and lived experiences, and I'm really excited to learn more about them and what those experiences are today. So first, I'd love to introduce Hanako Asuga, who's the program coordinator for the Science Education and Partnership here at Fred Hutch. Hanako, pronouns she, her, serves as the program coordinator for the Science Education Partnership, or SEP. For the last 30 years, SEP has supported secondary science educators across Washington state by providing all the equipment, regions, and supplies teachers need to run hands-on labs in their classrooms, as well as professional development and curricular resources. Many of the curricular projects she has supported in her role focus on centering social justice in the science classroom and promoting equity in science education. Hanako also serves as co-chair of the Community of Employees for Racial Equity, or CEAR. Today, with her fellow co-chair and members, she hopes to create an equitable and just community and promote racial justice in all work done at Fred Hutch. Hanako is a second-generation Japanese American and a lifelong resident of Seattle. Welcome, Hanako. So happy you can join us today. Next, I'd love to introduce Kayla Silvio Bird, the Executive Assistant for our Facilities and Campus Operations. Kayla has worked for Fred Hutch for 8 months and works specifically for our Facilities and Campus Operations Department, and directly supports Jeff West as his Executive Assistant. Before coming to the Hutch, Kayla has worked for the Washington State House of Representatives, directly supporting a member as their legislative assistant. The Hawaii State Senate, working as a legislative aide for a Native Hawaiian Affairs Committee chair, and working for a federally funded community health center in Bremerton, Washington, where she was able to help with community outreach, education, and healthcare administration. Kayla got her bachelor's degree from the University of Washington in policy and law. She loves serving and working with her community to find ways to get over the barriers that they may face. Her passion lies at the intersection of health equity, community outreach, and social justice. In her free time, she enjoys spending time with her 2 dogs and her husband, and cooking with her parents and siblings. Kayla is a Chamorro Filipina American woman raised by a biracial immigrant mother from the Philippines and a biracial Chamorro father from Guam. Welcome, Kayla. Thanks for being here. Next, I'd love to introduce Nicole Ann Rodes. Nicole Ann, pronouns she, her, sha, has worked at Fred Hutch for over 7 years, originally with our legacy Seattle Cancer Care Alliance, where she was the chair of the Filipinx American Affinity Group. She's worked in various departments, starting with our revenue cycle department, housing and family assistance, and now genetics and prevention, directly supporting Mercy Larino, the Director of Cancer Genetics and Prevention, and Bethany Henriquez, Clinical Operations and Nurse Manager of the Wellness Center and Supportive Care Services. Nicole Ann is a second-generation Filipinx American, raised by both her mother, father, maternal grandparents, and her siblings, who all immigrated from the Philippines in the early 1980s, originally to Southern California, and eventually relocating to Seattle in '93. Her passion is to connect with the Filipinx heritage through community events, led by organizers that identify as Filipinx, Filipinx American, or as an AAA NHPI. She is currently taking classes to enroll in a nursing program and eventually become a nurse practitioner to increase access of cancer prevention within the AAA NHPI community. Welcome, Nicole Ann. Thanks so much for being here. And finally, I'd like to introduce Dr. April Kaur Randhawa, Senior Staff Scientist with the Vaccine and Infection Disease Division at Fred Hutch. Her career has been dedicated to preventing infectious diseases that disproportionately impact minoritized and marginalized people and communities around the world. Her research focuses primarily on evaluating vaccines for tuberculosis, HIV, COVID-19. April identifies ethnically as Indo-Canadian Punjabi Sikh, born in Canada to parents who immigrated from Northern India, and she uses she or they pronouns. Thank you so much for being here, April. So glad you can be with us today. All right. I just want to say welcome, everybody. With those long introductions, I'm so delighted to be with amazing panelists, again, joined by Cyree as well. I'm looking forward to engaging with you all for this roundtable discussion, and absolutely want to reiterate what Paul mentioned. We are in community with each other. Absolutely will welcome your questions, your reflections, and any comments into the chat. So please feel free to use that function as we start in our conversation. So let's start our conversation and start talking about AAA NHPI, or Asian, Asian American, Native Hawaiian, and Pacific Islander. So this group, which we're all part of here on this panel, is part of roughly 50 ethnic groups that make up the Asian diasporas. So there's a ton of diversity, there's a lot of nuance, a lot of complexity within our communities. And then, as we know, our communities are far from monolithic, but there can be a lot of shared experiences among our differences as well. So I'd like to open it up to any of our panelists here with this question. What reflections do you have about that statement, about what I mentioned? Where do you see commonalities? Where do you see variation? So just opening up to anyone who would like to get us started.
I'll lean in here. So, you're right, it's like this grand monolith. And, I think a lot of us have a complicated relationship with this like pan-ethnic labels as Asian or Asian American. And I recently was reading about a Pew Research study that where they spoke with a lot of different people in the U.S. who are from this, often categorized in these broad categories because of surveys or documentation or other ways that we have to select our race. And it's really difficult to take thousands of languages and thousands of ethnicities. Even just within India, there's 2,000 ethnic groups. So it's really difficult to kind of group them all together. And it doesn't always allow us to, it's not necessarily how we view ourselves and our identities. And there can be, it's just very broad and ambiguous, and it lumps together all these groups. Even the term South Asian, which is a little more specific, also includes some East Asian groups. So, there are a lot of different reasons why it's difficult to use these broad categories. But there are things that I think unite us. And one of the ones I've been thinking about is our immigration experience for our ancestors, or might be even recent. Some of us are a non-naturalized person in the U.S., and some of us are first gen or been here for a few generations. And I think that we're all at different stages of that, but it is one reason why we come together in community around things like food and ceremony and other cultural traditions. We're at different parts of our journey, whether it's early on, and some early immigrants that were trying to assimilate, to try to not be seen as causing waves or disturbances, and just trying to get their feet on the ground and get established here. But others are further along in that journey, where we're trying to take more pride in our cultures, and trying to bring those things and share them with their new communities here. So that's something I've been thinking about that does unite these broad grants.
Agree, April. Thank you so much. Yes, as you were talking, I couldn't help but nod along with you. And like, yes, I can absolutely relate to a lot of that. Other reflections? Oh, Hanako.
Yeah, I'll go off of what April mentioned. One of the things that they mentioned that I was also thinking about was the identity aspect. I think growing up, especially, I mostly identified myself with my ancestral lineage. So I would say I'm Japanese before I'm Asian. And often that is a box that we are forced to put ourselves into, if not forced into by other people. Like, people add that identifier to us. And so I think we share that as these incredibly beautiful and diverse people with very different cultures and community being shoved into this box. And I think that is one of the things that really unites, I think, not just the Asian, Native Hawaiian, Pacific Islander community, but also a lot of minoritized groups, that is our shared experience of we are here and we are minoritized in a way that I think it's shared across a lot of groups, I believe, like to live in this society. And I think that is one of the things that make it easier for us to see each other as who we are, like these incredibly amazing, diverse people, and to recognize that in other groups, no matter what community that they belong to.
Thanks so much, Hanako. Yes, that whole idea of self and cultural identity and communal identity and societal identity. And I love what you mentioned about being sometimes forced into a box, that I know that so many of us can relate to. Other reflections?
Yeah, I think that thinking about kind of, what commonalities do we have, what things that unite us. A big thing for me that stick out is just moral obligations. I feel like a lot of our, communities really have these, responsibilities to our elders, to our family. And I think that really unites us in all the conversations I have is, how do we treat each other? How do we, love each other and make sure that we're safe and that we're here for each other? And so I think that's a big thing that unites us and keeps us strong. And I love that you guys are talking about identity and the differences within this big overarching, your PI or NHPI. And for me, I'm Micronesian, but I wouldn't even say Micronesian because I don't like how historically we were given that title, right? So it's just something that, for the Western people, it's easy to digest. And, I think that now in our time, in our generation, we can really, say, okay, we don't like to be called that. We don't like to be referenced that. And you're going to call me how I want to be called. And I think that's really empowering, that's starting to happen.
I can add something in there as well. I think for me personally, I want to say at least the past year, it's been interesting kind of leaning more into learning about my heritage as well, and finding out that, I'm not the only one who was kind of grown up to assimilate as an American, even though I was born here. But I remember even just as early as like middle school, like seeing my peers speak their parents' native language. And I myself cannot do that. That's something that I felt a lot of shame about, thinking like I am different from like a lot of my family because I can't speak Tagalog fluently. But I'm not the same as some of my peers because they're really connected to their heritage. So one thing I've found in this past year is that, it's nice to know that I'm not the only one who's kind of stepping into this and learning about my heritage and kind of being okay with not knowing everything yet. So I think that's one thing that's been uniting a lot of us who feel that way too.
Thanks, Nicole. Any other reflections? Ray, do you have any responses or any questions you'd like to piggyback off of for the panelists?
Main question, well, thank you all for being here too and taking time to share. I think the main question coming with today is thinking about maybe what are some of the experiential causes to health disparities within our communities, but also in what ways are our communities excelling in certain health aspects. I think the word resiliency is put out there a lot, but I think there are ways in our upbringing or traditions that might be challenging the way that Western medicine has been treating different illnesses. So just curious about your thoughts on those. I have some of my ideas, but I would be really interested to hear what you all have.
I can start us off. I kept thinking back to what Kayla was mentioning earlier about how a lot of our communities have a strong connection to family units, whether that is immediate family or extended family or chosen family, but we have a culture of caring for our family and thinking about family as the base unit. And so I think that's one of the things that I can speak of from my lived experience as like, you take care of your people. And I think that is something that's really strong within our community and shared across our community as well.
I would say in terms of, what are some things that are factors that impact our health disparity, specifically within, the Chamorro population and in Guam, I think there's a lot of barriers to healthcare and how they receive it. Not having proper funding, not having, places to go and get treatment, having to go to the mainland and things like that. Not having, data and systems to collect what's going on and have, knowledge of how we can stop that and prevent certain things. I also think that just knowledge around screening in general for, Chamorros and Pacific Islanders, they don't have, I think, proper education on it or clear guidelines or like what the guidelines are. So it's been really hard to get them into the doctor. And I think just barriers around, income, hesitation with Western medicine and just not really trusting the, Western medicine in general is a huge barrier. And I think when you meet people where they are and go out to the community and serve the community in that way, that's the most effective way to get over those barriers. So I think it'd be really important to do those things to kind of impact and really help, the health disparities within that community.
Yeah, I agree with what both of you have said, and so one example that comes to mind for me is, as like many of us, we end up, being translators and advocates for our relatives, and going to doctor's appointments and things like that. And it's amazing how often we hear things like, "Well, you're from Indian descent, and you have to really worry about things like diabetes and cholesterol. You all eat a lot of butter. Like, that kind of myth really has just taken off for many, many years. And first of all, how we make food at home is not like how you get at your Indian takeout. Buttered chicken is not a traditional dish. But there are many other factors that do lead to increased rates of things like diabetes and issues with cholesterol and heart disease. And some of those there are some that have some small genetic components, but really it comes back to these like structural barriers and oppressive systems where it's access to health information, access to care, food deserts. Communication with health providers is a huge one when there may be not only language barriers, but also just the cultural differences and how openly you talk to healthcare providers, and sometimes a fear of showing vulnerabilities for different reasons, especially people who are recently immigrated. There's a lot of fear around, well, is this going to be something that gets me kicked out? Maybe my visa or green card is not going to go through. Like I have to be constantly watching out for that. So many of those things are really what lead to the disparities, not how we eat. So, but that's one that comes to mind.
Definitely agree with everything you all have said previously. Personal experience, I know, is that at least with my family, is they like to travel in packs, right? So when they go to appointments, it's nice to have, one or two people with them, one to help translate and one to just accompany. And so for one thing, with the pandemic, having only one person available or being able to come to the appointment is also difficult, speaking from experience, as well as, having to be the one to translate, but also having to be the one to remember all the information and relay it back to the family member. And then also making sure that, that they're taking care of themselves. So then it's like, okay, am I making sure I'm doing everything that I can? And also, April, what you had said about food, with, at least from what I know, is, rice is a part of almost every meal. And then to hear things that, in order for you to lose weight and cut down on the blood sugar, you need to cut down on the rice. And it's like, that's not going to work for some people, because sometimes that's all that they can stomach down, or sometimes that's all that they can afford. So I think that's one thing to also consider, is like the language barrier, also being cognizant of different culture, customs, as well as diets too.
Yeah, I 100% agree with that. I think that when, in Guam, one of the things that they chew on is betel nut, and it causes, world cancer and things like that. That's been around for centuries. How are you going to tell this culture and these people that they can't do certain things that's, integrated, and so it's really hard to just have those conversations, I think, especially when you don't understand the background of, certain things in our cultures. I also think that, when you're mentioning people going to the doctor with you, my Lola didn't speak English, right? So like I go to the doctor with her. I think that, we can advocate for ourselves easily, and a lot of people can, not in these communities, but we have to advocate for other people. They don't have voices, right? So it's like we're advocating for every member of our family because we know how the system works, right? Like my Lola didn't know how insurance works. I could barely understand it, so really having to advocate for other people and be that person, I think, is like echoed in all of these, things that we've talked about.
I actually also wanted to add one more thing, and I'm not sure if those who identify as Filipinx or Filipinx American also agree, is knowing that there is a big population of folks who identify as Filipinx or Filipinx American that work in healthcare. One thing I do find comforting is when you can recognize someone who does identify, so it kind of makes the person feel better when they're going to their appointment. But I also think that's kind of like a double-edged sword, is, if a relative who's pretty savvy in healthcare tells them it's going to be okay, but I think you should get that checked out, they never listen to that second part. They just hear, oh, it's fine.
So true. I see Terry wrote in the chat as well that another barrier is continuity of care, and how that really exacerbates existing barriers and obstacles. And I think we've all kind of alluded to that a bit. But yeah, so if you are spending time, you have a relative or an advocate who's coming with you, and you're establishing a relationship with a healthcare provider, well, as we all know, that can change, and you have to go to a different doctor. Your insurance changes, and you can't go to see that person that you've established that with. You have to go through all of that again. And I think there are ways that we can improve that and break some of those barriers down. And one easy example is like translation services. They're available, and they're not used as often as they could be. And I've seen and heard others who have seen where, although translation services are available, they're seen as a bit of a waste of time, or it's just gonna, we have to wait too long, and it's skipped. But that just really has a lot of ripple effects leading from that.
Thank you all so much. Another aspect as I'm listening to you all talk is kind of the trust building as well, which is such a huge component to our communities, is that form of trust. And just piggybacking on the comment in the chat about continuity of care. If there isn't that trust with the provider, you have to start over with someone else, and so on and so forth. So everything you all have mentioned is so important, and again, just so much resonance with all of you. In continuing this conversation, what does our community need from our health providers, in addition to what you've all mentioned right now? And then what do our AAAA NHPI providers need from their employers in order to provide that care that's so needed for our community?
I would just say patience. I mean, that's one thing I really want to emphasize, is that there's this need to rush through everything. Like, we need to get this done right away. We need to start surgery right away. We need to start treatment right away. And it's like, well, have they considered the fact that maybe they want to talk to their entire family first to see how the entire family feels? Because within our community, we need to make sure that one decision doesn't detriment everybody else that could be affected by that.
I think also behind that patience is mattering. We need to matter. We, as members of very different communities, need to matter and truly matter, so that we are granted this patience, granted the time that we need to process in the ways that we process. And so I would say that that's what is behind all of it.
Yeah, and being seen as humans, and not at first, and not as what we appear at first. Just all the assumptions that we know happen with implicit bias, and that's the bare basics. Can people, can we have implicit bias training and education as a bare minimum, right? So that people can identify their own biases and think about how that has implications for their patients. Whether it's a nurse, a person at a screening desk, as you're checking in, at all those different levels that we see this happening. And my family is from the Sikh faith, so many of the men wear turbans, and my grandmothers would dress in traditional clothing, going to see healthcare providers. And right away, there are a lot of assumptions that happen. Even the ones that do speak very English very well, there are assumptions that happen about that. So I think there's some very bare basics that we need to have across the board. But then there are different, of course, a lot of different, more complex challenges and needs. I can't speak to what healthcare providers would need, but I can speak from like a data perspective. And this is, I think, to me, the most important piece of this conversation we're having that started with, you know, this monolith of A and HPI or Asian, and that aggregation of so many different individuals and cultures. Well, that aggregation is also happening in the data, in the surveys that we have, in the healthcare systems and all the, you know, records. It's also all being aggregated there. So, you know, we see examples of this in the media when it comes to, you know, looking at voting and which communities voted for who. And of course, you know, there are so many different groups within this monolith, and we don't see those individual things. We see it when we see media reports about median income, that, oh, Asian Americans have higher median income, whereas we know that there's some communities that have, you know, very high poverty rates, you know, certain Asian communities. So that aggregation is just causing a lot of issues. It doesn't allow us to analyze the trends and lead to those, identify those research questions that we can ask. We can't solve the problems that we don't even know about because it's hidden in this aggregated data. So I really think it's important that we have nuanced data to improve, you know, poverty, health outcomes, and all of these things, and not missing out on some of the communities that right now are kind of invisible and hidden in those data. So I think that will really that help a lot. That being said, we have to engage those communities in that because there's a lot of fear around data collection surveys, especially when it comes to immigration and other reasons why minorities and immigrants in this country might fear data collection.
So many good points, April. Thank you so much. I have so many responses to what you just said, but I don't want to ignore some of the action happening in the chat. So I did want to bring up a comment and a question that Kirsten asked. So Kirsten wrote, I used to work at a nonprofit called NAPCA who supports the elderly AANHPI communities across the US, and they have a multilingual call center. Why do you think the AANHPI communities would rather use this call center than the local languages services offered by the city?
I think that, you know, we're coming from SQHC, right? So a nonprofit that's like smaller, community-based. It's really important for our providers and our, you know, our clinicians to really know the community. So I think that it makes people feel safer and trust a little bit more when they know that these people are in the community. They know what their community looks like. They know the different nuances within the languages within these communities. And I think that's really important. And even going back to the previous question with that, right? So it's like our providers and people need to know the community to really serve them well. You need to know what makes up your patient population and how to, you know, culturally competent, like, you know, get education to serve them. So I think that trust is really important. And I think that's probably a big factor on why they would rather call locally, right, and know these people.
Thanks, Kayla. Great question, Kirsten. Just to circle back on what April had mentioned, we're such a data-driven society, and especially in medicine and healthcare specifically. So really resonating strongly with you, April, about the data piece on how we can kind of untangle the data and look at more detailed information on how we can better serve our communities and bring that visibility. And, you know, at the Hutch especially, there's a saying that we all say with data is, what is the data telling us? What's the story? And that was what was hitting me hard when you were responding and sharing that information. So thank you. Sairae, did you have any other questions for our panelists that are coming to mind for you?
Thanks, Tiffany. Other questions coming with today is just as far as your experience working at Fred Hutch. In the application process for this program, I learned that there's some dialogue series for staff members working at Fred Hutch, specifically for BIPOC staff members. I'm curious if any of you have been participating in any of those, or how you've grown or connected with your colleagues through that experience and how that's maybe changed the way that you do your work, or just curious more about that process and those experiences.
I can speak a little bit about my experiences. So I think, as Tiffany mentioned in my bio, I'm also a co-chair for one of the employee resource groups here. And I think that has also led me to really great community. Like, I've met Nicole Ann and Tiffany both through that work. And I think, especially in a place as large as the Hutch, especially after the merger now, if you're in a smaller department like I am, you're kind of siloed there for your work or your day job is how I think about it. And so the first few years here, I didn't find my community here. And through that work, through these intentionally created spaces, I've been able to connect with wonderful people that I wouldn't have otherwise crossed paths with.
The same for me. I've been involved in DEI related efforts pretty much my whole life, and I've been at the Hutch for 10 years now this year, and been trying to be involved in some of the employee resource groups here at Fred Hutch. But it's been in the last few years since the DEI core has been formed, and where I've seen a lot of improvements and a lot of real change happening. And there's a lot of people who did a lot of work in the background leading up to this, but I definitely want to acknowledge the DEI core and what they've been able to do. And one of those things is bringing together BIPOC employees at Fred Hutch and the BIPOC caucus. And the importance of an exclusive space for employees of color is like it provides so many unique opportunities, and for me it has changed the kind of my perceptions of how well I belong here in this environment, in this this cutting edge research institution, and it makes me feel like I belong, and that I have people who have shared experiences and who will support me as well. And not feeling so alone goes a long way for so many things, for giving you more satisfaction in your employment, but also feeling connected and feeling like there's purpose. And so I'm super grateful for that. And I've loved the different ways to connect, not only with the BIPOC caucus, but with Hutch United, which is another employee resource group where I used to lead some of the outreach work and still am involved there. But these groups have really helped me feel a sense of belonging here.
Yeah, I think that, I'm newer to the organization, so having this was new to me, and I really appreciated it, and all these resources and all these amazing things that, we're able to touch and do. And I think because of that, my leadership specifically saw an opportunity to really dive in with our own work, with our own vendors and partners, and to see, okay, do our priorities align? Let's see what they're doing, and, talk about what we're doing. Let's learn from each other. Let's give our vendors, an opportunity to do better by what we're doing. And just having that and being, participating in that project and really leading it here in our department was really empowering and powerful, because the DEI core kind of initiated that in my leadership. So I'm really thankful for those, things that happen.
For me, thinking back actually to the application period, when I did my interview, I actually interviewed with someone who identifies as Filipino. And I honestly, in all of my years in my career, I have never, ever worked with anyone that identified as Filipino up until working here at the Hutch, or at the time, like a SCCA. So I feel like that experience kind of catapulted me into learning more about my heritage, because I would observe them, eating lunch with their coworkers who are Filipino as well. And I was like, oh, wow, there's a lot of Filipino people here. And then moving on to different departments and, eventually meeting, Mercy and Tiffany and everyone else within the DEIC, and then eventually the Filipinx American Affinity Group. It's been great to, meet people who can teach me a lot about my heritage, that I never really had a chance to learn about. And it's almost like it was serendipitous in a way too, because, I think I felt like I was kind of floating around of being Filipinx or identifying as Filipinx most of my life, but really up until working here, kind of really showing that pride, like, yes, I am Filipinx and I want to learn more about it.
I think also one thing that the word that came to mind as I heard everyone talking about was also authenticity. These spaces were co-created by members of our community for our community. And I think that is what sets it apart from other groups that I've been a part of at other like majority white organizations. And so there is that piece where the group feels authentic and intentional. And so I can be authentic in my work as I come. We spend 40 hours a day here, it could be virtual or actually on site, but I feel like I can bring a side of myself, an identity that I wasn't always allowed to bring.
Yeah. I think involving or improving the ability and quality of how people of color participate in science and research is not just important for the sake of equal opportunity. It's been shown to increase scientific excellence and innovation, and that's a huge goal of the Hutch, a huge part of our mission. So it's really following through on that and showing that we are committed to improving health, making it more equitable, and pursuing scientific innovation as well. And we're a part of that. All of us are a part of that work and an important part of it. And we also are in the community a lot, right? We have outreach events, we have students and trainees, and it's important for all of them to see themselves in us and to know that they're not alone, they'll have a community here, and that this career, this is something that they want to pursue, is for them. So I think that it's important that we continue to follow through on that mission of trying to improve health equity, but also scientific innovation by including historically excluded groups and minoritized groups.
Thank you, April, and everyone, just for sharing all of your perspectives. Just even as a facilitator, as you're all talking, just in my mind, I'm like, yes, 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 that's exactly, how I felt, and agree that I have not traditionally worked in a place where I can authentically be myself and proudly say that I'm a Filipina American. And I know that it's been mentioned a couple of times earlier in the conversation about the importance of our identity, this need to assimilate, kind of feeling some isolation at points. So it is really a breath of fresh air to not just be in community with one another, but that it's welcomed, and also even expected, to really bring that authenticity, really to what April was even mentioning, for engaging with others from underrepresented groups in our science, in our innovation, and in our medicine. So it really is those three components together. It's a really an equal blend of marriage that needs to happen. We only have 2 minutes left. Just maybe just a parting question for you all, which could be as elaborate or as short as you'd like in the time that we have left with each other. But what does a thriving AAA NHPI community look like to you?
I think for me, one of the biggest things that I would love to see, is in future generations, creating generational abundance, creating things, systemically we didn't have before, creating generational wealth, right? Having representation, really changing the narrative on how we're viewed in Western media and how we're viewed just in Western culture in general, is really important to me, because then I think, the kids from Guam here in the States, in the mainland, can really be like, okay, I am reflected in these things. I want to learn more about my culture. I want to learn the language. I want to be a part of those things, and really have this resurgence of learning our traditional ways and being empowered by that, not being embarrassed to talk about those things, and creating that, in generations to come, living long lives. I really hope that we can overcome those barriers.
All right. That was the perfect response and ending, Kayla. Thank you, Saire, Hanako, Kayla, April, Nicole, and thank you for your responses and having this great discussion. Really appreciate everyone who tuned in for this public art dialogue. We look forward to raising the banner and the flag on January 24th at noon, and hope to see you all there. Just want to underscore my appreciation. Thank you all so much.